I love to sing. I love to perform in musical theater. And I love to be with family and to have fun. I have been married for 25 years. I have a 20-year-old son who will be a junior at Emerson College. I first found out in a roundabout way that I had ovarian cancer. I had gone for a routine colonoscopy. Immediately thereafter, I started to have abdominal pain, severe pain. I went to my internist, and he suspected it was gynecological. I went to see a specialist affiliated with Meridian, and he confirmed the diagnosis. I had surgery, and then 3 weeks later, I was undergoing chemo at Jersey Shore. I would say in terms of coordinating the surgery, the chemotherapy, the post-operative therapy, they made it as smooth and as easy for me and for my family as possible. And the chemotherapy department was so well run and so uplifting. My biggest challenge going through treatment was change. Everything was changed. I learned to accept so many things that I didn't before. I learned to take life easier. I laugh and pray a lot more. I complain a little less. I'm a 3-year cancer survivor. I feel great. I'm loving life and enjoying the journey.
That clip is pretty powerful, and the two guests who I have with me here today see patients like that and hear stories like that all the time. And they are Drs. Evelyn Minaya and Dr. Manuel. And you look like you're getting a little choked up from that.
I am.
What's your experience watching that video?
I have patients like that. And it's always very difficult, not only to give them the news, but also that it does affect their lives forever. And you know what, it's a bond that you create with your patients, and it is forever. Everybody thinks about only the obstetrical portion, the fun, the happiness of having a baby and all of that stuff, but the gynecological is anywhere from as early as 12 all the way up to 86. And actually my most mature patient is 101, God bless her. So, you know, we have lots of years together. So.
And Evelyn, let me make this clear. You are board certified in obstetrics and gynecology at
Yes.
Meridian Cancer Care.
Yes.
And Dr. Manuel as well, board certified in gynecological oncology at Meridian Cancer Care, and this program is part of our Taking Care of New Jersey series that we are doing in cooperation with Meridian Health. It is breast cancer, it is ovarian cancer, it is cervical cancer. This is what you are screening for pretty much every day.
Absolutely.
How common are these cancers in women today?
Unfortunately, breast cancer is our most common one, and 7 people get it. But we do a lot of emphasis on that. We forget about the rest of our bodies, like from the breast down. So we have to talk about uterine cancer, which is the most common of all the gynecological cancers, and that's cancer of the uterus. And it's usually presented in postmenopausal women, and usually they present with postmenopausal bleeding. So it is important to have a relationship with your gynecologist because it doesn't end after babies. Then, of course, the second most common is your cervical cancer, which, by the way, is really the preventable one, if you will. And if you have your PAP, really, every year, you should not be able to get cervical cancer.
Cervical cancer is preventable?
Cervical cancer is preventable. Most cervical cancers are caused by the human papillomavirus. Not only do we have now a vaccine that we can inoculate our children with to hopefully prevent, and nothing in medicine is 100%. So I just want to make absolutely clear, right? But you can really reduce the incidence of it by having your regular pap smear. The incidence of having in the United States cervical cancer is 11,000 women. Out of those 11,000 women a year, 85% of those have not had a pap smear in 5 years.
So it is as simple as, and I don't want to say that anything in the medical world is simple, but for patients, it is so important and could be as simple as going to your doctor for a yearly checkup, for a yearly pap smear, yearly mammogram. I mean, early detection is really what could save lives.
Right. Which, unfortunately brings us to our last one,
yes,
which is ovarian cancer, which early detection is not our good thing.
Right.
We don't do a great job at it because the symptomatology is so vague, and it's very hard to catch at an earlier stage, so to speak. And usually women that are postmenopausal, women that have never had children, but not necessarily. So obviously with our clip that we saw before, so atypicality also exists as well. So you have to keep your ears open, your eyes open, and you have to listen to your body.
What are some signs of ovarian cancer? What do women describe that they're feeling by the time that they're diagnosed, which unfortunately too often is in stage 4?
Right. Stage 3, stage 4. And unfortunately, it's very vague. It's bloatiness, but it's not a bloatiness like most of my patients understand. It comes and goes. This is a bloatiness that keeps on going. It doesn't get better. They have a loss of appetite. You're losing a little bit of weight with, no exercise, no diet or anything else like that. You just feel tired. Very vague symptomatology that you can have like 101 other diseases that you can attribute that to.
Dr. Manuel, how do you work with Dr. Minaya? Dr. Minaya is in fact diagnosing a lot of these diseases, and how do you get involved?
So GYN oncology, the specialty that I practice, is pretty rare. There's only about 800 of us in the country. Wow. And so we have to actually rely on our obstetrician gynecology colleagues to help identify those patients that need our intervention. And we hope, that is not a frequent occurrence. But unfortunately, some people do require a little extra. And so we try to be there as much as we can. And like you said, they're picked up often by our obstetrician gynecology colleagues.
Talk to us about laparoscopy and robotics, which are two new innovations in surgery. How are you using that? What does that mean?
So laparoscopy has actually rather exploded in our field over the last 10 years. It's been a modality that we've been using. Gynecology is one of the specialties that really sort of invented it and really mastered it. In our field, we tended to do a lot of open surgeries for people, but now we're getting much better at using laparoscopy and the technology that is now available to us to do surgeries on patients with big masses, people who've had a lot of surgery before. There's a lot of great technology that we can utilize to help bring minimally invasive surgery to cancer patients, including staging, biopsying lymph nodes and everything. And I think it's very important because you get a scary diagnosis and most people think they have to have a big surgery, which is not always the case. And I think people really have to understand there are a lot of options out there in terms of especially minimally invasive surgery.
And there probably are a great number of fears that people have that are probably not warranted anymore with new procedures like what you just explained.
Oh, absolutely. I think with a cancer diagnosis, people assume you have to do a big surgery to get to lymph nodes, to get to other aspects of it, maybe a big tumor. And that's not always the case. This can be done laparoscopically very effectively. And there's technology that's coming out, literally every day that's helping us to do better things laparoscopically. And I think people really need to talk to their doctor and kind of explore these options, even when they have a cancer diagnosis.
And what's interesting is the way that you two work together, and it's actually really important for the patient that you two work together. Dr. Minaya, when you do diagnose a patient and you hand them off to Dr. Manuel, you don't actually hand them off. Is that right?
No, I'm very hoardish. I can't do that. So usually what happens is I have his cell number, I text him. And, but you need a team like him who is willing to see your patient and not make them wait, because he knows that it's a serious diagnosis, and then we have to do that, number one. Number two, he's also excellent, and that's the other thing too. I'm not going to, give my patient to somebody that I don't want them to operate necessarily on them. But most importantly, I get to operate. He's gracious enough to let me be the assistant. And that, I think, if I've known a patient for 10 years, now she has this horrible diagnosis, I give him off to an expert, but I'm there to hold her hand. That's part of my wonderful job.
How important is that for the patient to know that they have someone who they trust to stay with them through that process? What does that do for the patient?
I think it really promotes better healing. I really, really do. And I think that a better attitude that you have in terms of your outlook, and that you trust the people that are operating on you and they're going to take care of you, I think you do much better. We've actually done studies on ovarian cancer survivors, and their attitude and their family support really increases your survival rate. And I think that's true of every single disease process.
And Dr. Manuel, the Nurse Navigator program is so important to the patients as well. Explain what that is.
So Nurse Navigator is a topic that is being talked about a lot more. The National Comprehensive Cancer Network, which is a nationwide network of cancer centers, really is pushing this at all cancer centers. And it's just one way to help a cancer patient with a scary diagnosis access all the resources that may be available. As a surgeon, the surgeon may have some things that they know about. Their primary doctor may know of other things, but a nurse navigator can help them get access to psychotherapy, alternative treatments, acupuncture, massage therapy, supportive services that they may need to help them cope, in addition to getting appointments for their radiation follow-up, finding transportation to the hospital where they may have to come to the hospital every day for treatment. And it's an invaluable service which helps to, I think, get the focus on the patient away from all their care and to just kind of get that focus back to healing. And they really need that. It's a very important service that everyone should always ask about. Most cancer centers are trying to develop and specialize in that.
Before I let you go, I wish we had more time to talk about this, but I want to ask if you had one piece of advice to give to somebody, be they a patient or not, what would it be?
Live life to your fullest. Be healthy. Okay, really respect your body. If you respect your body, you're going to get a lot out of it. Okay, enjoy your life. Laugh a lot, just like that young lady said. Laugh a lot, pray a lot. That's also important. And definitely embrace your family and wonderful colleagues. Appreciate everything that you have every day.
That's a great answer. I don't know how you're going to top that one, Dr. Manuel, but what advice would you give?
You know, I think communication is key. Unfortunately, in medicine, patients don't really have a very good communicative relationship with their doctors. You have to demand that, especially when you have a diagnosis like cancer. You should expect your doctors to communicate with you, and if they don't, find a group of doctors who will. And I think that's very important.
Doctors Minaya and Manuel, you're really making a difference for people every day from Meridian Cancer Care. I can't thank you enough for being here today.
Thank you. Thank you very much. Thanks.